Hello, my name is Mike Brown. Uh, the best way that I can answer this question for you is how to find a home care agency that can provide caregivers to you uh, if and when you need them. So, my advice would be even if you don't need hands on assistance or need a caregiver right now, it's still a good time to start looking at different options. There's a few different ways that you can do that. Google reviews are a great way. If you are part of different caregiver support groups like the Parkinson support group or maybe a local caregiver support group, asking people who they've worked with and what their experience was like, and looking for a word of mouth recommendation is one of the best ways, in my opinion, to select a agency that can provide a caregiver for you. Now, once you have those in place, or once you've selected 2 or 3 companies that you'd like to talk to, I would encourage you to call them, set up an assessment. Most companies will come out and provide a free in-home assessment for you. You can discuss what your needs are, what your concerns are. They will give you literature, pricing on what it costs, and this way you're able to make a well vetted and educated decision when it is time to decide for home care services or for a caregiver to come in. I hope this is helpful to you, and I wish you the best in your decisions. Thank you.
Coming to the emergency department is not an event most people look forward to. It can be very frightening and chaotic for you and your family. However, there are a few things you can do to help your providers during your stay. First, having a list of any medications, including vitamins and supplements you may take. Secondly, a list of any known medical allergies is also very beneficial. Thirdly, a list of your current medical providers can help your doctors and nurses contact those who know you best. Other things you may consider having is a caregiver stay with you throughout your stay who is familiar with your medical history. Lastly, any items that you may bring with you, including walkers, CPAP machines, blankets, or things that you use for your mobility or comfort, make sure they're properly labeled with your name so that we may get these items back to you should they become lost.
Yeah, hi, my name is Dave Flickinger. I'm a member of the Columbia Parkinson Support Group. I'm here to talk to you about my DBS experience, and I'm also going to admit that I'm going to be cheating, reading off some notes to keep it organized. 2 things I gotta say right off the bat. First of all, expectations. Second of all, it's a long process. I'll explain that in a second. I had my DBS done on the left side because I had right side tremors in February of 2020. I've had Parkinson's for about 5 or 6 years at that point, and I was in relatively good health, so I decided it was time to get it done. I chose an institution that had a good record, and a good surgeon and a good neurologist who worked a lot of DBS patients. I think that's important so that you can feel rest assured that you're going into a good institution. The surgery itself was pretty easy. It was a 2-parter. In the first part, they put the probe in my left side of my skull, and about 10 days later, they came back and installed the DBS actual device and connected it up. Those went fine. I didn't have any major side effects. Very pain-free. I took one pain pill over both surgeries. That went very well. Then about a week later, the fun starts, because then they connect the probe to the device and they start looking for your sweet spot, or that spot where you have minimal movement disorders and without side effects. And believe me, like I said before, it takes a long time. Think of it this way. If the probe has like 4 areas, A, B, C, D, each area might have 8 or 10 settings or strengths. So think of that, and 30 or 40 different settings that they can try. And You can't put it on a setting and a day later say, I don't like that, and change it. A day later, I don't like that, and change it. So you might have to let it set at a setting for 4, 5, 7 days or something like that. So it takes a long time. It's not like you're going to be in a wheelchair one day or stumbling and next day you're out climbing Mount Kilimanjaro. It just doesn't happen that way. Also, if they let you tweak it, they might send you home and say, okay, you're setting B12 or something. You can change it a little bit if you feel like you're getting a little symptomatic. Make sure they give you good directions on how much you can change it and how often, so that you're able to record your feelings about how it's working and give them good feedback. It's been about 9 months, and I'm not sure if I hit my sweet spot yet. I don't know if I'm there yet or not. Like I said, it takes time, and I know that for a fact. And expectations. The expectations are what symptoms can DBS help? Well, tremor. Tremor is pretty much gone on one side. That's good. Rigidity or stiffness, pretty good shape there. Bradykinesia, slowness of movement, I'm pretty good there. However, on the flip side, sometimes DBS can contribute to a few things. Like one is speech problems, and as you can see, I'm having some speech problems. I'm working with a speech therapist, and it's a little bit troubling to me because I'm a talkative guy. And the other thing is movement disorders in terms of balance problems. Sometimes they're temporary, sometimes they're not. And I'm working with a physical therapist to address these issues. Could be that when I was done, COVID-19 hit, the gyms were closed, I was not able to work out, so I'm playing catch up for several months being off. But still, I am more concerned about that. Now, would I have it done again? Not sure. It depends on how bad, if I had tremors on the other side, how bad they get. But I know it's going to take a long time, and I think I have a better understanding of the expectations. Good luck to you. Bye-bye.
Hello, my name is Michelle Reed. I'm with the Columbia Parkinson Support Group, and I am answering the questions submitted for our virtual open forum as it relates to DBS outcomes. And with working with DBS patients and clinicians for 10 years, I would say that outcomes are going to be directly related to the overall health of the patient, the stage of the disease, the experience of the movement disorder neurologist performing the programming, the neurosurgeon performing the implant, and the support system available to the patient. So to dive a little bit deeper into those components, I would say first and foremost, finding an interdisciplinary team at a recognized DBS implanting center is very important. That interdisciplinary team would consist of a deep brain stimulation movement disorder neurologist that is experienced with managing both the stimulation and medications, and as well as those non-motor symptoms associated with Parkinson's. It's also important to find an experienced DBS neurosurgeon who has done multiple cases, as well as having a physical therapist or occupational therapist that has experience with working with Parkinson's patients pre and post implant, as well as a speech therapist, and then lastly, a neuropsychologist. Also, having a care partner and a support system is very important. You will need someone to take you to and from your follow-up programming sessions, which could be multiple, and whether that be a family or a friend, or a pastor or someone from church, it's very important to have somebody to walk with you through this journey. And then managing expectations is really a key component. So what are you wanting to accomplish? Are you wanting to go back to work? Are you wanting to play with your grandchildren? Are you wanting to tie a tie, button a shirt, tie your shoes, a reduction of tremor. It's very important to discuss your expectations with your physician because we would need to be sure that those expectations are met and fully discussed so that you're not disappointed in any way once the procedure is done. And then I would also say, lastly, that patience is really a key. This is a long process. So, there are some patients that have some relief right after implant, and some take a little bit longer. So it may take 6 months to a year or even 18 months in order to be able to find that sweet spot between medication and stimulations. And yes, ideally, it would be nice to be able to reduce the amount of medications that a Parkinson's patient is taking. But the reality is that most patients still do have some type of medication on board. So it's just understanding that it's a long process and just to be patient. And, lastly, it really is effective and can really improve your quality of life and get you back to those activities of daily living. Thank you so much.